Ladies and gentlemen, good morning. Thank you all for being here. I am Professor Chang from National Taiwan Normal University, Taiwan. This is my big pleasure and honor to have a presentation in International Organization for Health, Sports, and Kinesiology. I want to have my special thanks for Dr. Hong Song Shou, my good academic friends, as well as the CEO and founders, IOHSK. With big heart for our field, I can tell how he's hardworking to organize the wonderful international conference. Before I start, I would like to introduce where I come from. I come from Taiwan. The former name is Formosa. Dates back from 15th century by Portuguese sailors. By means of Formosa, it means the beautiful island. Taiwan is also known as Heart of Asia because it is located in southwest of Korea, north of the Philippines, and east of mainland China. I hope that you can visit Taiwan in the near future, and we will be very welcome. The topic I'm going to present today is entitled Acute Exercise, Cognitive Function, and Brain, the updated from Asia, particularly from my research lab. Exercise has been linked positively on many mental health, including reduce the negative psychological status, such as the stress, anxiety, and depression. Exercise also positively associated with many positive psychological status, such as affect, emotion, mood, quality of life, and well-being. These days, more and more research have examined another important mental health aspects, that is, cognitive function. So let me introduce what cognitive function is. Cognition is original come from Latin words cognoscis, which means to know, or the process of thought. There are many subcomponents within cognitive function, such as the ability of perception, the abilities of learning, memory, reasoning, and the way to solve the problem, planning, and make a decision. As you can tell, this subcomponent of cognitive function is very important for daily life. No wonder World Health Organization identify cognitive function as one of main components within health-related quality of life. We know the cognitive function is important, but to exercise that we interest associated with cognitive function, we need to provide the scientific evidence. We now have many studies, but how we read these results? What evidence should we believe? This is a triangle of the level of evidence from research. From top to down is the highest evidence to weakest evidence. The top of the level of evidence is the national or international guideline. And then the second place is the research from systematic review or meta-analysis. Here, I want to particularly focus on meta-analysis. Meta-analysis is one type of review which is related unbiased compared to narrative review, because it is used the objective way, which is the statistical approach to examine the relationship between independent variable and the dependent variable. So meta-analysis represents the conclusion of the research in a particular issue at that time period. So it's a very important conclusion. Do exercise and cognitive function have meta-analysis? Yes. In 1997, Dr. Jennifer Adonai from the University of North Carolina at Greensboro. She provided the very first meta-analysis related to exercise and cognitive function. In this meta-analysis, she included 134 studies, which derived about 1,200 effect size. The final conclusion is that exercise have significant and positive association with cognitive function. In 2020, our updated meta-analysis further concludes that chronic exercise, which means the long-term exercise intervention, performed with a frequency of 3 to 4 times with vigorous intensity, as with forms of Tai Chi and yoga, as well as length of training period from 1 to 3 months, provides beneficial effect on executive function, the higher or meta level of cognitive function. Not only for the research, the updated WHO guideline on physical activity and the sedentary behavior also indicate that exercise is a positively impact cognitive function, regardless children and adolescents, adult and older adult. Similarly, the updated ACSM guideline for exercise testing and prescription published by 2021 also add a whole new chapter, that is brain health and brain-related disorders. Overall, all this information from research to authority academic organization show the new concept how exercise benefits cognitive function. That is very encouraging. We know exercise is awesome, not only for the physical health. Right now, it's extended to brain function, cognitive function. But we also know there are very few about the percentage people to do the exercise. Why is that? One of the main reasons people don't do a regular exercise is too busy. If like this case, is any possible like we can find the shortest time to do the exercise and make the people have less excuse? We might have the answer. Indeed, in 1997, the meta-analysis conducted by Dr. Adler should not only identify the positive relationship between exercise and cognitive function, should also provide 2 exercise paradigms. First one, named the chronic exercise, means long-term exercise. Another type of exercise paradigm is acute exercise, which means a single bout of exercise. She indicates that chronic exercise have larger effect compared to acute exercise. However, both of the exercise paradigms can improve the cognitive function. That means, even when you conduct one type of exercise, can also increase the cognitive function. These evidence are also further confirmed. For example, in 2012, our group conducted another meta-analysis that specifically focusing on acute exercise and cognitive function. And the results show that better cognitive function can be observed during acute exercise, as well as immediately following the termination of exercise, or with a delayed duration after the termination of exercise. This study today has been cited by more than 1,400 times in the world. As we mentioned before, the highest level of scientific evidence is the national guideline. Do we have that? Yes, we do. In November 2018, USA government published the updated guideline for entitled Physical Activity Guideline for Americans. In this guideline, is described that the acute exercise have the benefit for cognition. Indeed, in the same month, JAMA also published the summary communication, and it described that new evidence show that the single episodic of moderate to vigorous physical activity can improve the cognition. The result is very important because it's not only the guideline, but it's the guideline derived from the scientific evidence. Indeed, in order to create this guideline, U.S. government organized a research team, recruiting a professional from public health and kinesiology. They used the 2 years to write a scientific report based upon the updated 10 years research. And they wrote a scientific report in March 2018. In this report, he created a whole new chapter called Brain Health. This is one page of the scientific report. You can see the text highlighted by yellow is the sentence that related to my research, cited my research. And specifically, you can see the subtitle is Acute Bout of Physical Activity. Indeed, in the end, it's described that acute bout of moderate to vigorous physical activity have the transient benefit for cognition, including attention, memory, crystalline intelligence, processing speed, and executive control. And the evidence grade is strong. So now, I hope that I convince you that acute exercise have beneficial effect for cognitive function. But what is our next step? In order to answer that, in 2019, we wrote a commentary in Sports Medicine entitled How the 2018 U.S. Physical Activity Guidelines are a call to promote and better understanding acute physical activity for cognitive function gains. Indeed, in this commentary, I provide a 3WYH framework, which means in order to further understand the effect of acute exercise on cognitive function, 3W, what type of exercise regarding intensity, duration, value at the time, or what type of cognitive function that excitement, and how is that happen, and in the end, who and when, which means the potential moderator to influence the relationship which to excitement in the future. And here we do have some updating. I am going to focus on 3 different topics from my research to answer what to maximize the acute exercise effect, who receive more effect from acute exercise, and how does acute exercise affect cognitive function. The first issue I focus is exercise intensity, which is also the most important component within exercise prescription. And here is our result. If you are going to conduct a cognitive function test immediately after the exercise, we will suggest you do the exercise intensity from very high to moderate. If you are going to conduct a cognitive function somewhat a long time after the cessation of exercise, we will suggest you do the exercise intensity from light to very high, but not the maximum. If you don't have any preference, exercise with light to moderate, particular moderate intensity can also improve your health. That is the intensity you might choose. Except the exercise intensity, we also examine the exercise duration. If is the longer exercise better? We don't know. In this research, we separate the older adult into 3 different conditions. That is no exercise, and the main exercise with moderate intensity for 10 minutes, 20 minutes, and 45 minutes. If you include the 5-minute warm up and the cool down, that will be 10 to 20 minutes, 30 minutes, and 55 minutes. And then we are going to see what is the best duration for the older adult. Here is our result. We observed that for exercise with moderate intensity for 20 to 30 minutes and 45 minutes to 55 minutes have similar effect. Okay, so here is our suggestion. If you don't have time, exercise with moderate intensity for 20 to 30 minutes is the exercise prescription you might choose. If you have more time and your body can take that exercise with 45 to 55 is benefit for you. So based upon this research, we can identify, customize the best exercise for the different population. The next study I'm going to focus is our recent study, focused on what and who. We recently research already identified one gene named ApoE84, which is related to Alzheimer's disease. If you take the one ApoE84, you will have 3-fold compared for population without ApoE84. If you carry the 2 ApoE84, you might have 12 times to gain the Alzheimer's disease compared to a population who don't have ApoE84. So here, that means people who have the ApoE84 carrier, they are in the risk of Alzheimer's disease. And we are wondering if the acute exercise with 20 to 30 minutes can have the beneficial. And more importantly, can we change the exercise intensity and the duration if they have the similar exercise volume? And here is our result. We observe that once you do the same exercise volume, you might be able to change the intensity and the duration. That means acute exercise with moderate intensity for 30 minutes improve cognitive function in older adults with ApoE84 carrier. And the beneficial effect of cognitive function can be observed when the exercise volume is set, regarding the alteration of intensity and the duration, which is very interesting. The next issue we are going to focus is how is that happen? Indeed, this question is to answer the causal relationship between acute exercise and cognitive function. And in order to answer the causal relationship, one of the components named the biological plausibility is very important. In our lab, we try to use the ERP, event-related potential, to examine the neurophysiological response. The ERP is the measured brain response that is the direct result of a specific sensory, cognitive, or motor event. Specifically, ERP is the EEG that is induced by repeat stimuli or events. ERP is beneficial to have a high temporal resolution and allow us to examine the different stage of information processing speed based upon the different wave. This is a study that we examine the acute exercise on cognitive function within ERP. And what we observe is that you can see the figure here. The right figure is the participants' brain activation after they do the exercise, when they engage in the cognitive task. The left side of the brain is the participant without doing exercise and conduct the cognitive test. The more red color means more activation. And then you can tell, even we stop the acute exercise, when you conduct the cognitive test, you still have more brain activation compared to a reading condition. And in this time period, and this component means your brain have more attentional allocation to allocate attention to the given task. Not only in this study, we also conduct a similar study which focuses on more components of the ERP. We observe the similar result, which means acute exercise not only change your behavior, but also your brain. The next study I'm going to introduce targets on the drug, particularly methamphetamine. We all know the drug is not good, but when we ask the people who have addict in drug, they tell us they know the drug is not good, but they cannot resist themselves to engage the drug. For me, that is the ability to self-disciplinary or ability to inhibit the attraction of the drug, which is the very high level of cognitive function. And as we mentioned before, acute exercise can improve cognitive function, including the inhibition. If in that case, is any possible that acute exercise can improve cognitive function? We conduct one study. We observe that when people start to do exercise, regardless the light intensity, moderate intensity, or high intensity, they will reduce the drug craving. However, only when the moderate intensity, they can improve their inhibition ability in behavioral index and also the neurophysiological index. That means acute exercise with moderate intensity might be the best exercise prescription for people who have addict in the methamphetamine. Next semester, National Taiwan Normal University is going to create a whole new program entitled Continuing Education Master Program of Addiction Prevention. And I am excited that exercise science will be included in the course. We can expect that exercise science will be involved to help more different populations, including population with drug abuse. In my presentation, I firstly introducing cognitive function. Then I introduce the new research associated with acute exercise and cognitive function that I conduct from my own research lab, where we observe that exercise with moderate intensity with 20 to 30 minutes have the beneficial. And once you set up the exercise value, you can alter the intensity and the duration. For population with adult with risk of Alzheimer's disease and even the methamphetamine, they can receive the beneficial from acute exercise. The reason acute exercise can cognitive function might be because acute exercise induce brain activation and also increase the attentional resource. These benefits of exercise of cognitive function and brain health is based upon our updated science. Thank you very much for your dedication to hear my ongoing research, and thank you again for the invitation from International Organization for Health, Sports, and Kinesiology, and also Dr. Hoso So. I hope that you can visit Taiwan in the near future, and we will be very welcome to meet all of you. See you and wish you have a great year of tiger. See you. Bye bye.